My name is Beth Scharpman. I'm one of the occupational therapists here at Olmsted Medical Center. In my practice, I do 3 different things. First of all, I work on our hand therapy department, treating lots of injuries between the elbow, forearm, wrist, and hand. I also work in our lymphedema clinic, and our lymphedema clinic treats swelling that happens in a body part, whether it's the legs, the arms, the abdomen, the face. And the third part of what I do is I work at the hospital, and I see people who have just had surgery or are in our inpatient hospital. I became an occupational therapist because I feel like it's a good marriage between science. You really need to know your anatomy and what's going on with the body, but it's also teaching. And I like to teach my patients what they need to do to make themselves better. When they come in to see me for lymphedema therapy, I want them to know that we'll treat the whole body, we'll really help take care of the swelling or these wounds that they have issues with. When they come to see me for hand therapy, I like them to know that we'll take a look at what they're doing on a functional level and what we need to do to get them back to functioning again, whether that's buttoning their shirt or chopping vegetables or driving their car. Really being able to hone in on what can't they do for themselves and what we need to do to get them back to their functional level. I do 2 different things. One is working with hands, and we see people who have a trigger finger or have fractured their elbow or have had surgery because a tendon ruptured. We see some very specific things in our hand practice. And then with the lymphedema treatment, we work with people who have had breast cancer and had lymph nodes removed. We work with people who have really swollen legs and have wounds on their legs. And those specialty areas are things that I work on with patients at Olmsted Medical Center. I feel like occupational therapists are really lucky because we get to see real-time results with our patients. They come in, we work on something, and right then and there, they're making a change. And that part feels really good. In making connection with the patients, I feel like we get to make results happen right at the time that they're with us. I feel like I get to know them a little bit on a personal level so that I can understand what we need to accomplish in order to get them to function again at their highest level. Outside of work, I like to work in my garden. I have kids and I like to coach them in sports. I like to spend time outside and be active. Coming to Olmsted Medical Center every day is such a joy because of my coworkers, for one. They're awesome. We support each other. We help each other if we have questions, but also looking forward to seeing my patients every day. They're fun to work with. They make progress right as you're seeing them. It's very effective, and both the patients and the coworkers are things that I look forward to.